I'm thrilled to welcome our co-moderators for our 2021 Los Angeles Neuroendocrine Tumor Patient Education Virtual Conference. They are key figures in the LACNETS community who serve and care deeply about our NET community. So I'd first like to invite each of you to introduce yourself, who you are, where you're from, and your role in the NET community. Let's start with you first, Dr. Hendifar.
Thank you, Lisa. My name is Andrew Henderfarr. I'm a medical oncologist working at Cedars-Sinai Medical Center in Los Angeles. I'm a medical oncologist who specializes in the treatment of neuroendocrine tumors.
Thank you, Dr. Hendifar. Welcome. And let's go to you, Dr. Lee.
Hi, everyone. I'm Dan Lee. I'm a GI medical oncologist at City of Hope and co-direct the neuroendocrine tumor program here at City of Hope.
Welcome, Dr. Lee. It's good to have you. Let's go to you, Mary.
Hi, my name is Mary Donlevy, and I live in Southern California. And I have been a pancreatic neuroendocrine patient and lived a very full and active life despite my diagnosis 16 years ago.
Welcome, Mary. It's great to have you. And last but not least, Beth.
Hi, my name is Beth DeBlase, and I am a GI NET, and I was diagnosed in 2016, going on 5 years, living very fully as well with NETs.
Thank you so much for being here. And in this first section, we're going to first talk about the first part of the NET journey. So oftentimes, when someone first finds out that they have NET, you would often see a medical oncologist or perhaps a surgeon. You'll often hear that advice, go see a NET expert. So I'd love to hear from each of you. What advice do you have for a NET patient who's preparing for their first consultation with a NET expert? Let's first go to you, Dr. Hendifar.
That's a great question. I think it's really important that one keeps an open mind when they're going to see a NET specialist. You might have a preconceived notion of what the recommendation might be or what the plan of care is going to be recommended. But I think it's best if you keep an open mind, try to listen to what the physician is saying, and I think you'll be pleasantly happy with what you hear.
So I think I'm biased somewhat in this. I've been working with LACNETS for a long time, and I would say my recommendation to you is really to go on the LACNETS website and immediately fill out your NET vitals. So this is really a communication tool that I've been able to develop alongside with LACNETS, and it's essentially a checklist to allow you to find out what you don't know about your NET diagnosis as well as treatment, and ultimately what questions you can ask your physicians as well as providers to get the necessary information throughout your neuroendocrine tumor journey.
Yeah, on the heels of what Dr. Lee said with NET vitals, one of the biggest recommendations I can possibly give is to make sure you have 2 complete sets of records, and one of which is sent ahead to your physician, and then one you bring into the office so everybody is well prepared prior to your appointment. And really important also is to make a list of questions that you have for your physician. It'll kind of keep you on track, and you often may not get the amount of time you want with your doctor, so it'd be really helpful to have the list of questions prepared prior. And any questions that come up in between appointments from here on out, I would highly recommend you write those down as soon as you think of them so you don't forget anything. You think you won't, but I promise you will. So that'll help you in preparation, and it will be really helpful for the doctors as well.
Following along the same lines of advice, one thing I would recommend is that it's okay to experience a little overwhelm during this first initial visit. And because of that feeling, it's probably a good idea to go in with also something like a pad and pen, not only with your NET vitals, but even if you have access to any kind of recording device that you're able to refer to later. Because trust me, you'll probably need to refer to it later, and that will be something that will be vital to you and your physician as you go through this process.
Thank you, Dr. Hendifar, Dr. Lee, Mary, and Beth for sharing your advice and insights about this topic. And now we're excited to introduce our first set of speakers. I'll hand it off to you, Mary.
I'm very pleased to introduce you to Federico. He is a pancreatic NET, and similar to myself, had a Whipple a number of years ago. And he has lived a very, very fulfilling life post-diagnosis. And I think you'll find his story very inspiring.
I'm very pleased to present a good friend and colleague, Dr. Heloisa Soares, who is a medical oncologist from the Huntsman Cancer Institute of Utah. She's going to give a presentation titled, What to Expect with the NET Expert Consultation. And a fun fact is that she trained at UCLA, where she earned her MD and a PhD in molecular biology. So welcome her home today.
And I am honored to introduce Dr. Calicia Clark, who is a surgical oncologist from the Medical College of Wisconsin. And her presentation is titled To Cut or Not to Cut, What Your NET Surgeon Wants You to Know. And I think that's a very relevant and important topic for our NET patients.
Thank you all. And for our Spanish-speaking audience, Dr. Suarez's presentation and Federico's story is available to view in Spanish on our website. And the URL is lacnets.org/Spanish resources. Thank you to our presenting sponsor, Ipsen and AAA.